more people. So, all right, good evening. Welcome to Just Conversations. I'm Laura Miller, and I'm the Volunteer and Community Engagement Manager for JustDane, formerly Madison Area Urban Ministry. JustDane helps transform individual lives and social systems to create a just and equitable community. We're delighted to welcome you to the fourth session of our 2021 Just Conversation series. We envision the series to engage our neighbors in discussion around important, timely issues that are affecting our community. And our hope is to keep them in more of a conversational format and focused on really creating solutions as opposed to just stating the problems. Logistical items, I am streaming this live on Facebook. If you're coming to us from Facebook, thank you for joining us. You can feel free to put any questions you might have for in the comments. And if you're with us on Zoom here, you can just put them in the chat, and we are hoping to have about 20 minutes or so at the end to answer any questions. So tonight we have JustDane's John Gibbons, and Linda Ketchum will also be here. And we'll be in conversation with Sharon Bowie, Ann Lacey, and Eric Howland. And we're going to be talking about the COVID-19 pandemic conditions in Wisconsin's institutions over this past year, and go from there. So I will throw it to you all to briefly introduce yourself, and then we'll get started with the conversation. Okay, John, would you like to start?
Sure. My name is John Gibbons. I'm the Social Support Coordinator. I've been at JustDane now for 11 years and been out of prison for 41 years.
Laura, you're muted.
Okay, Eric, you can go next.
Oh, okay, I'll go next. I'm Eric Howland. I'm past president of MOSES and have been connected with MOSES for a bunch of years, and also with Breaking Barriers Mentoring. So maybe that's all I need to say.
And I'll follow up since I'm the other MOSES person. I'm Ann Lacey. I've also been involved with MOSES for quite a while. And just in case anyone doesn't know what MOSES is, we are a local faith-based organization affiliated with Wisdom, which is a statewide organization, and we focus on criminal justice reform.
Hello, my name is Sharon Bowie. I am currently a certified peer specialist, and I work for the Veterans Transitional Housing Program for Porchlight Incorporated. I was relatively recently incarcerated, and so I have a firsthand knowledge of some of the responses to COVID-19.
And I'll bring up the rear. I'm Linda Ketchum, the Executive Director at JustDane, but I'm mostly just going to be listening.
All right, so I guess we wanted to start maybe with Sharon, just since you were directly impacted, giving kind of a testimony as to that experience and what information you received when it happened, and the access you had to healthcare and testing. And if you can share your story, that would be a great place to start.
Well, thank you. First of all, let me state that it is an honor and a privilege to be here. And I hope that at the conclusion of my testimony that we'll have some beneficial information that we can use to go forward to combat this particular affliction. I was paroled from prison in June 30th, 2020, after serving 25 consecutive years for the crime of first-degree intentional homicide. I spent the last 11 years of my time in prison at Oak Hill Correctional Institution in Oregon, Wisconsin. There I served a number of positions while I was there. Toward my latter time at Oak Hill, I was working on the farm, and that's when COVID-19 hit. and it hit like gangbusters. But the one thing that I'd like to express before I tell you exactly what I observed during that is that, just to describe to you very briefly, that prison operates on rumor and innuendo. And whenever something of that type of nature happens in a prison cell or in the prison yard or in the prison construct, rumor is rampant. So when COVID-19 hit, we did not necessarily have primary or even secondary reliable data that we could rely on. Instead, we operated off rumor and innuendo. So that's what happened when COVID-19 first affected me at Oak Hill Correctional Institution. Now, there are two types of responses from the staff at Oak Hill when COVID-19 first hit, and throughout my time while COVID-19 was prevalent in the institution. There were the guards who were overly cautious. These were the ones, when you walked into the room, they would literally, actually, physically run across the room away from you. I remember walking into the office at the Oregon State Farm, and one of the guards actually slid his chair all the way across the room in order to avoid contact with me, because that's how fearful he was of catching COVID-19. And then there were the other guards who were at the opposite end of the spectrum, who just did not believe that this particular disease could affect them. And they did not believe the information that was being promulgated on television. There was a lot of contradictory information, if you all remember, when it first came about. There were some who believed that you needed to wear a mask, some who believed that you didn't need to wear a mask, some who believed you could only catch the disease in certain ways, etc. So these guards, because there was some contradictory information, assumed that all information was contradictory, and they did not believe in the seriousness of this disease. So we had the operating on the two spectrums at Oak Hill Correctional Institution when COVID-19 first hit. As I said, we were, now let me back up for a second. After COVID-19 had become prevalent for about a month or two, the institution began to shut down specific pockets of it. For instance, we could not go to recreation. We could not go to the library. You could not necessarily even walk the track. You couldn't congregate in a communal form in any way, shape, or form. You couldn't sit in the day room. You could sit in the day room, but you could not be on the patio and congregate with the other individuals on other units. This was ostensibly for safety purposes, but we were allowed to still go to the day room. We were allowed to still utilize the microwave oven. And at that time, only the individuals who worked at the Oregon State Farm, such as myself and the other men, were allowed to leave the institution and go to Oregon and work on the farm. At the farm, none of us were required to wear a mask. As a matter of fact, during the early days, the first month or two, you got one mask per week. And if you wanted to get another mask, they were charging you $1 per mask. And this is a prodigious amount of money, because the salary for certain prisoners is like 11 cents an hour. So in a 2-week period, you may make $8 if you're lucky, and then they're going to deduct from that child support payments. They're going to deduct from that any restitution that you owe, etc. So you may end up with $1.75 for working 2 weeks, and out of that, you're expected to spend $1 on that to purchase you a mask. And then what ended up happening is that they went to the Oregon upholstery shop and they used excess fabric to make masks to give to individuals. Now, of course, the masks weren't sanitary. Some of that fabric had been down there for 5, 6, 7 years, and they still utilize it, but you were able to get a mask, and you could wear the mask if you chose to wear the mask. If you did not want to wear the mask, you were not required to wear the mask. A couple things that I noticed when I was there, and I did get sick, but I'll get into that in a second, is that as individuals began to develop symptoms of COVID-19, the response from the institution and from the administration was predictable in that they were isolated. And in prison, whenever any type of benefit is to be accrued to a prisoner, it is oftentimes administered in a way that causes the prisoner more hardship than good. For instance, if you went to the hospital and they believe that you might have this disease, you would immediately be sent to the hole, and you would be isolated without your television, without contact with other individuals. You would be in the hole, literally. So therefore, it did not behoove you to go to the hospital. If you had any symptomatology, and there were several guys on this unit, Unit A is the one I was on, you'd see them sneezing. You'd see them holding their, nose running. You'd see them exhibiting some of the signs of individuals who had the flu or who had the cold or who even had COVID, the upset stomach, etc. But they would not go to the HSU department because if they went to the HSU, they were told they would be isolated for 2 weeks in the segregation unit. So that created a groundswell of trepidation, for lack of a better term, because you didn't know if this guy who was sneezing over here may have COVID-19. And because rumor and innuendo is so prevalent and flowing all throughout the institution, you don't know if he sneezes on you if you're going to die. Now, of course, I didn't believe that we were going to die, but you didn't know the extent of this. And then you're seeing on the news how 6 people died today, 5 people died today, 12 people died today, 18 people are in the hospital on ventilators, etc. Well, you don't have access to any of these things. And so you didn't know exactly what the result would be if you were to get sick. And still we were required to go to work. If you didn't go to work, it would be a deleterious effect on you in regards to parole and in regards to PRC, because you would be terminated. And if you're terminated, it seems as though you're not complying with the rules and regulations. And as a result, that would actually set you back in several ways. So, excuse me. So you kept on going to work, you kept your head up, and you just dealt with the consequences of that. So for me personally, I alluded to the fact that I would talk about being sick. One night I went back to my unit after being on the farm. An individual, I won't say he sneezed on me or something, but he had been sick. I came back to my unit. I had extreme chills. I couldn't sleep. My bed was soaked through. My stomach was just nauseated. I wanted to throw up. And I wanted to go to HSU. I was actually willing to go to the hole for 2 weeks. That's how bad I felt. I wanted to go to the hole for 2 weeks because I felt as though there was something wrong with me. I was terrified because I didn't know exactly what the symptoms of COVID-19 was, because they kept changing. They kept saying this was the symptoms, then this would be the symptom, etc. So I didn't know if I had it or not. So I finally mustered up the courage. And I remember this so vividly, walking to the guard and telling him I had to go to HSU. And I was informed that HSU was no longer accepting individuals. So at the time I made the decision that I was going to go to the hole, that I would be willing to suffer the 2 weeks of isolation without my property, without my food, without anything, HSU stopped accepting people. And to me, it was just mind-boggling that they kept me on the unit in the room with a roommate, and I was extremely ill and extremely sick, and no one knew if I had COVID-19 or not. Fortunately, it's a blessing, but I recovered the next day to a certain extent to where I knew I was going to live. And then after that, I got a little bit better, and I just kept right on working. And that was my experience with being ill at the farm during the height of the COVID-19 craze. I can tell you this, that I do know that there were several people who manifested the symptomatology and did not go and did not report it. And I believe that a number of individuals, I can't say, I'm no doctor with a degree in microbiology or anything like this, but I believe a number of people evinced those symptoms and they just did not report them because of the effects that they would have to deal with if they had done so. But Ironically, once again, even though I reported it, I still wasn't able to go see HSU. Towards the end of my time at Oak Hill, HSU refused to see anybody. One of the things is when you're leaving prison, you have to sign out. You go to various other departments in the prison and you get them to sign a waiver saying you don't owe books, you don't owe money, etc. So as I did this, you were only allowed to go in and see guards, and they were signing the papers for you, but not one of them, not a single guard that I communicated with when I signed out was wearing a mask. In fact, if there were 2 guards who wore masks during the time I was there, that would be a lot. I did not see them. And when they talked to me 2 feet away from me. No one wore a mask. No one took any precautions. There was no hand sanitizer. I didn't even see hand sanitizer until I was released on June 30th. And then when I was released from June 30th and I'm walking down East Washington Avenue on my first night out, just enjoying the sun, and I'm approaching people and I'm about to say hello, and people literally almost crossed the street away from me. This was the first experience I had of something like that. And while I was at Oak Hill, there was no type of separation, no type of castigation, no type of alienation of anyone who evinced any type of sign of COVID-19. So that is my experience while I was there. And if you have any questions or if you need any additional information, then please don't hesitate to inquire.
I've got a question. It came from a presentation that was done at the county by Dr. Eason up at the UW. And he said that a lot of communities that had prisons in them had higher rates outside the prison of COVID because people were getting COVID in the prisons and then going out and in the communities. It sounds like from what you were saying, at HSU wasn't testing anybody, they weren't seeing anybody, that easily they could have been sending people out into the community who might be infecting other people.
Well, my response to that, and I can attest to this because it affected me directly. And I need to give you a little bit of background so that you understand how it affected me. In the job, there is in prison, there is a hierarchy of what's called community custody jobs. The lowest job on that hierarchy is the utility crew who cuts the grass along the sides of the roads, etc. The second phase in that, which I was, would be the Oregon State Farm. And then the final phase would be the work release jobs that are inside the communities who work for organizations and businesses out in the community. After the COVID-19 had hit, and I would say once it was determined that this was going to be a pandemic, in the initial phase, there was a lot of uncertainty. No one knew whether or not it would be solved quickly. I don't know if you all remember, but the president said, we'll be able to fix this in a couple of weeks. But after it became apparent that this was going to drag on, Oak Hill did pull all of the individuals who were working out in the community work release jobs, so that the only people who were leaving the institution were a second phase individuals at the Oregon State Farm. And we were only there because the cows had to be milked. That's the only reason why we had to go there. And they let it be known, somebody's got to milk them cows. And guess what? I'm not messing up my manicure. So we would go out there. There would be 6 of us on the first shift and 6 of us on the second shift, and we would milk those cows. And so I can't attest to whether or not individuals were bringing COVID into the community, but I do know that they were not leaving the prison, because to say that I was upset would be an understatement, because I was this close to getting one of those work release jobs. I was literally like a week away from getting a work release job when they pulled everybody back off work release. So that's what happened in that regard.
When did they stop the visits?
Stopped the visit around the same time that they stopped individuals from going out in the community. And it was just It was just overnight. It was told that, as of Monday, there will be no further visits until like next week. And then it was the incremental type thing, much as Lyndon Johnson did with the Vietnam War. Every week we'll add just 1,000 people or 1,000 people until there's 100,000 people there. Well, that's how it was with the visits. We're going to stop visits for this week, but we should have them again next week. Or no, we're just going to go another 2 weeks, and then we're going to go another week. And by the time I left, there were no visits.
So it wasn't the visitors bringing it in either.
It could not have been the visitors bringing it in because you weren't allowed to interact with anyone. The only people who could bring that into the prison, and again, I'm no doctor with a degree, like I said, but it had to be a member of the staff because no one else was allowed into the prison. And we were only allowed to go from Oak Hill Correctional Institution to Oregon Institution. We went directly from A to B. We get into the van behind the fence at Oak Hill, and we would get out of the van directly in front of the office at the Oregon State Farm. And that's it. And the only people we interacted with were the staff that was at the Oregon prison. So if we brought it in, and we were the only inmates that were allowed out, So if we were bringing it back, if any one of us brought it back into the institution, we could have only been infected by a member of the staff.
So did they space you out in the dining room or just bring the meals to your rooms or,
Well, again, ironically, because Unit A, where we lived at, there was no dining room on that unit. We had to actually walk to the chow hall. So we walked on the track communally to the track, and we ate communally. There was no separation. There was no 6 feet. I sat down right next to the guy and we ate. And that's what happened. There was none of this, you'll bring food to the room, etc. Now, I have been in extensive contact with a number of individuals who were there after I was released. One, because of my position now at Porchlight, Veterans Transitional Housing, a couple of veterans there who I hope, to transition out of prison, they may require some of the resources that we provide at Porchlight. So I've been in contact with them. I've also been in contact with a number of the individuals who I've known over the years. And some of the secondary information that I have received is that they did ultimately, after I was gone, a couple months after I was gone, lock everyone into their rooms and feed them like bag lunches and have meals brought to their room. They would allow individuals out like in 2s and 3s to utilize the microwave oven to make a telephone call, etc. But that's another thing. When I was there, we used the phone. You just use the phone. And you would stand in line for the next guy. And after he was done, you would use that phone. And I remember so vividly, I would always put a sock over the phone so that I wasn't necessarily touching it. Yeah, I know it's old fashioned, but that's it. I'm going to admit it. I'd put a sock over that thing and I would hold it a couple of inches away. And if I got super excited, I'd hold it about 3 feet and then just raise my voice a little bit, because you know how you press it up against your face a little bit closer? Never did that. But after the COVID thing, you never knew. You didn't know, because rumor and innuendo, what could be, what couldn't be, you just didn't know. And here's another thing that I want to impress upon each of you. The guards have a great deal of influence, particularly in bringing in information, because one, they're in a position of authority. So as a result, they have with them a degree of believability. If they say something, you tend to believe it because they have, in your opinion at the time, access to the information. So when you have a guard who does not believe that COVID-19 is a very serious pandemic, if he does not believe that you can catch it in some of the ways that we have discovered that you can catch it, if he does not believe that it's going to get you sick and possibly take your life, then that is what you tend to latch on to. That's what you tend to ascribe to. This guy is saying this, and he has information that you don't have access to. Why is this person presenting this information like this? Well, they're presenting this information because they believe it. And so you look around and you see no guard wearing a mask. You see the guards standing side by side, touching each other, walking together. You're walking with your buddy to the chow hall and nobody's telling you to stop. You know, you tend to believe that. And that's how it was. So I wanted to impress that upon each of you.
Then there's reason for the outbreaks in the prisons. If they didn't follow CDC guidelines like we did, if you guys weren't following them, you can understand why there would be such widespread outbreaks. Social distance, the mask, everything, you know. X's on the ground to remind you to don't get so close to each other. They didn't do any of that?
They did not a jot nor a tittle. I'm going to use that term exactly. Not a jot nor a tittle. And I can tell you that after I left, I spoke to, as I said, several individuals. They didn't do it then either. Now, I can't speak for other institutions. I can only speak for my experience at Oak Hill Correctional Institution. Not a jot nor a tittle. You could walk side by side. I had discussions like you wouldn't believe. I tend to be a somewhat loquacious or gregarious individual. So I get to yapping and yapping and yapping. So I'm sitting in the day room just talking away and guys are just all around me. And nobody's concerned about this. Although on the news it's saying there's another 360 people just died. But there's a guard saying, I don't believe that crap. And so you start, you make a decision. What's happening up there or what's happening right here. You've got and I don't know, I want to remind you all of this. Remember, there were two schools of thought when this thing first came out. There was like the president's camp, this is going to be over with in a week. It's just a really bad flu, that type of thing. And then there was it's going to kill you. It's going to kill you. And every person who they're using as an example is 90 years old with several types of heart disease, et cetera. So there was this dichotomy, bipolar opposites, if you will, polar opposites, if you will, of the belief system at that particular time. And the institution did nothing except for put up all these long papers. I mean, some papers were 3, 4, 5 pages long. And I don't have to tell any of you, when you walk up and you're trying to read something and it's 4 pages long, you read about a paragraph of it and then you walk away. So even the instructions that they were trying to provide us, to stay away from someone, 6 feet, social distancing, et cetera, it was presented in such a convoluted manner that you couldn't even take the time to read it. And so you said, man, what does this say? And this guy who didn't read it says, oh, it says this, okay? And that's what ended up happening a lot, because I know I was one of the guys who said that, so.
This might be a good segue into kind of talking about some of the data I mean, you have a real up close experience with Oak Hill. John, do you want to kind of take over here and talk about some of the data that we've pulled together?
Sure. Want to pull up?
Yeah, I will. We're just going to share. Wait 1 second. All right, can everyone see that?
Go to the next one. Okay, we can start from this.
Hold on 1 second. I got to the wrong one.
Yes.
Okay, so now.
All right, what you're seeing here is some data I pulled from some information given by the Legislative Reference Bureau would put out this information. There was if you notice on this chart that as of March 20th, they had around 1,000 cases in the institution, and it stayed that way until and it started increasing in May. Then in August is when it hit its peak. It went from about 2,400 up to, and it kept climbing up until the day that I know you see the dates on here at 4/28. It's right around 10,000, almost 11,000 people in the system has had COVID. Positive tests is 10,951. Inactive positive cases, 10,729. Release prison cases, 240. So they released 204 back into the community. Active positive cases today, but probably more, is 18. There's 994 people in quarantine. And current number of isolation, 26. This number of vaccinated is different, so I'm gonna go and I want to get to the death one later. But this is just information on how the flow went through 2020 to get to 10,951. You want to go to the next slide? All right, this is the COVID test that was given. I'm just going to highlight a few of them. You look at Dodge Correctional Institution, that was 778 positive tests. That was 15,498 tests given. You look at Fox Lake, there was 897 cases, positive tests. That was 432 tests, 4,352 tests given. Jackson, 608, and we're gonna go on down. Calamari had 887 positive tests and 5,426 given. That was 1,033 at Oshkosh. 9,306 tests given, 1,179 positive tests at Racine, 10,504 tests given. At Stanley, there was 421 positive, 4,490 tests given, making a total of 102,123 tests that was given at those institutions, and I just hit the larger number. Release positive case was 204. 25 came out of Chippewa Falls. 31 came out of Oshkosh. 18 came out of Racine. So then there was inactive positive cases. Active positive case as of today, as of 4/27, it's 18. 10,729 inactive positive cases. Okay. Then we go to the vaccine.
This is a good time to ask
Yes.
about your testing, Sharon. Were you ever given tests, and how did that look in the?
At the time I was there, first of all, I was never given a test, and you couldn't get a test unless you either reported sick to HSU, which I tried to do and they wouldn't take me, or if you had requested a test, you could ask them to give you a COVID test, and they would call you down this is what I was told. They would call you down and give you a test. Now, if you were sick, I do know two individuals, and John, you know a couple of them because they're in your circles. They got sick and they were called down there and they gave both him and his roommate a test, and they both tested negative. But those are the only two on my unit who got tested that I know of.
Okay. All right, here's the next.
Yeah, and the next one is the vaccinated by facilities. We're looking at Dodge. They got 265 people vaccinated. Green Bay, 418. Jackson Correctional, 398. New Lisbon, 433. Oshkosh, 750. Racine and Sturtevant, 544. Make total number of people that's in the institution now that's vaccinated is 6,437 out of 20,000. Okay. Then we go to the next one. Number of related death by facility. Okay. Yeah, really, let's go by. Dodge had 2. Fox Lake had 2. Oshkosh had 4. Red Granite had 3. Stanley had 3. While Pond had 4, making a total of 26. Oh, we were talking about that yesterday. Those 26 means, you know, if you left the institution and went to the hospital and was out of the institution for a day, they didn't count that as a death from the institution because they didn't die in the institution. So who knows what that number might be as to the number of people who actually died from COVID from prison. But as of DOC, they say 26 died in the institution.
John, do you know what the protocol was for like how sick and someone needed to be before they were transported to a hospital?
No, they didn't say that, you know, but I know Oak Hill had 60% of their population had the COVID, you know. But that's those are stats that I think you know, people can look at and sort of draw their own conclusion as to what, you know, out of 20,000 people, you only have 6,000 that's been vaccinated. I asked one gentleman yesterday, he said he had it. And I asked him, I said, what shot did they give you? They gave him the Johnson & Johnson. I don't know if they given everybody that shot or not, but I know 3 people I've talked to that had the Johnson & Johnson shot 1 and out, you know, so that's all I have. Any question about that. You know, I'm here.
You know, one thing that stands out there, John, Wisconsin Secure is Boscobel, right?
Yeah.
3 cases. Why? The inmates are locked down. There's limited contact between the inmates themselves and limited contact between the inmates and the staff. Everything goes through the door. Okay? It just shows you that was what they probably should have done. You know, you don't like it, but figured out a similar system. They only had 3 cases, you know, and again, it's because of the limited interaction between inmate and staff and inmate.
Yeah.
CDC guidelines.
Okay.
Same way with some of the camps. Why did they have such low, you know, numbers? Because they're spread out, they can go outside and stuff like that. You can probably open your windows up. You can space out between the people, whereby if you get into the more secure facilities, you're kind of stacked on top of each other and it's hard to avoid each other. Yeah. And that thing about the sock, Sharon, I worked at a federal prison and I always asked the guys, why are you putting that sock over that phone? And he says, well, if you haven't noticed, Mr. Siskey, he says, half the guys got the flu or a cold in here and they talk on the same phone.
Let me, Laura,
And it makes sense.
let me just read something else that they had in there. They say the COVID pandemic poses a unique challenge to state correctional authorities compared to the general population. Incarcerated Americans suffer disproportionately forms of chronic disease, including pulmonary disease, pulmonary conditions, tuberculosis, tobacco use, asthma, lung cancer, HIV. Prisons has also aged significantly in the recent years. Together, these factors make prison population especially vulnerable to COVID-19, which caused more than several severe illness among the older and those who have existing lung condition. While inmates movement may be restricted, the flow by staff, visitors, and volunteers and new inmates increase the risk of expanding exposure to infectious disease within the correctional facility. Compounding these problems is the fact that the correctional institution are confined spaces by design. Therefore, adhering to social distances and guidelines may be difficult at best or impossible at worst. Yeah.
You know, another thing, John,
Right.
when they did Act 10, didn't they limit the powers of the officers' unions to negotiate on things? Like the only thing they could negotiate was pay raises. In the federal system, they have full bargaining rights. So the union could say, okay, warden, sit down. We're going to talk about this. We're going to talk about the CDC guidelines. How are we going to do this, you know? So basically, the staff were powerless. It was the administrators making up the rules. They can't blame it on the union. The union couldn't negotiate on it. So it was the administrators were the ones making up the rules, getting the CDC guidelines, and what was happening at Oak Hill, they were just ignoring things, ignoring things they were seeing out in the community.
Yeah.
That's sad.
Yeah, it is.
So I'd like to bring Eric and Ann into the conversation now. As this hit, as representatives of MOSES, you want to talk a little bit about, as COVID hit and we started seeing the effects in the jail and prisons, what did MOSES do, and what kind of policies were you looking at kind of challenging? And if you want to talk about some of that stuff, that would be great.
Sure. So I'll talk a little bit kind of at the statewide level, and then maybe Eric, if you want to talk more about the local jail level. So statewide, MOSES was working, of course, with Wisdom, which is our parent organization, and then primarily really with Expo, which is ex-incarcerated people organizing, who always take a lead on everything to do with anything to do with the correctional system. So really early on in March already, we were sending letters to the governor and stressing the fact that this was a public health situation that was going to explode. And he, as the governor, had things that he could do where he did not have to go to the legislature. And these were laid out in letters sent by Wisdom and Expo. And then we had multiple public sort of awareness raising events, basically trying to compel Governor Evers to face this and to address it and to talk about it. And he, in fact, never really did that. So we had something called Storm the Capitol, which was a virtual one day where people all over the state sent letters and emails to Governor Evers. And then after that, there was the drive to decarcerate, and that was in July, and that was a big caravan, and then we went to the governor's mansion and had a press conference, and then there was a sit-in that took place over multiple months in the fall. And I mean, just many things that were done, in addition to ongoing individuals, and we recruited congregations and all sorts of people to write letters, to send mail, to, do all sorts of pressure on, specifically on the governor and also on the Department of Corrections. But that was the direction that we took. And while things did happen, basically Governor Evers, it has to be said, ignored all of this. So what happened in a sort of unofficial way. So our understanding is that people were in fact released, but it wasn't part of a stated policy. It wasn't Evers getting out in front of it and saying, I understand that this is a terrible public health risk. I am going to do these things to try to decarcerate, to try to get people out of the prisons and make them a safer place so that it would be feasible to do social distancing, for instance. And so I think anecdotally we have heard, and the numbers show that people have been released, and moreover, people were not transferred into prison, but this was not part of a publicly stated policy on the part of the Evers administration. So that's kind of where things stand with that, I think.
And I just chime in there that Moses has had a long time position that Moses and Wisdom have had long time positions that the laws that allow for compassionate release, this is for elderly people who are sick, should be, there's special laws that allow them to be released from prison, and that the prison system, the prison and the parole board should be actually using those powers and getting the people who were at high risk for dying in the prison out. And I think John mentioned yesterday that the people that were released, because the prison population went down from about 23,000 people down to about 20,000 people. I don't know, I have 30 in my head, but anyway, it dropped about 3,000 people. And most of those were elderly people. And of course, many of them would have been more likely to have long-term diseases than otherwise. So anyway, we've been advocating for the use of compassionate release. We still think that should happen more. We don't see any reason why somebody that's elderly and ill is going to be a risk to the community. So that continues. And maybe I'll segue then to talk a little bit about the Dane County Jail. If you give me screen sharing rights, I will show a picture of what happened in the Dane County Jail. All right, there we go. So can you see that now? There's a graph up there. And so, and I don't know, do you see my cursor here?
Yeah.
Okay, so here's the beginning of March. So this is what, March 13th. And quite rapidly, the people, this blue line is the people who are in the public safety building. So within a week or so, it dropped, from of a peak of about 400 down to, well, a valley of about 200. So almost in half in the public safety building. Not so much of an impact in the city county building. So I should say the jail is made up of 3 facilities. There is the public safety building, which is the one that you see on the street as you go around the square. The city county building, which is where you would go for a city council meeting or a county board meeting, but instead of being at that lower level, it's up on the 6th and 7th floor. And there's a jail up there that's been there for a long time, much worse facility. And then there's the Ferris Center, and the Ferris Center, oh, that's diversion programs. I guess the blue one is the Ferris Center, and that's where the work releases. And you can see that not too many people have been in the Ferris Center even before COVID, and that kind of dropped down with COVID, and people were not released for work jobs from the work release jobs. So anyway, we see this big drop here, much different than what you see in the in the state prison system, and that's true all over the state. Jails all over the state were much more effective at reducing their prison population and doing more distancing than might be otherwise happen. And so at the
Eric,
beginning, yeah.
Can I ask who were those people being released? Like, what were the kind of the parameters for who did they say, okay, they don't need to be in jail?
I'd like, that's a question I'd like to turn to. So I jumped to another slide here. So this is slide, it's only people under roof. So people who are physically in the jail. Some of those lines that I didn't really talk about were people outside the jail, like people on that have GPS monitoring. And so I just have a couple of lines here. So this top line here is pre-trial. So these are people who have, maybe I should go back and do it chronologically. So this blue line down here is pre-arraignment. So these are the folks that just came into the jail. They haven't had their initial appearance. They haven't been arraigned yet. So they're in the pre-arrangement status. This will only last for a couple of days. The reason these go up and down is every weekend they stop doing initial hearings, and then the population of the jail grows. And then on Monday or Tuesday, they'll start doing those hearings, and then it drops again. But so you can see that fewer people were coming into the jail from this pre-arraignment line. And so that basically the courts and the police were convinced by partly by the sheriff and partly by what they're reading, that unless somebody really needs to go to the jail, they weren't going to take them there. And so how did they drop the population of the jail? So one way is the police didn't put people in custodial arrest. And one of the things that happened was the courts said, if you stop somebody and you run a check on them and you find out that they have a warrant out for them, you, depending on what kind of case it is, you can just schedule them to come in to a hearing, and not in person, but a virtual hearing, and you don't have to take them to the jail. Whereas before COVID hit, if there was a warrant out, then you pretty much always end up in the jail. And so that was one of the ways people never got there. They never got into this pre-arraignment category. A next category here is the DOC holds. So as you know, people get out of prison and they're under the supervision of the Department of Community Supervision. I guess that's redundant, but anyway. And if the parole agent doesn't like something about what they're doing, or they get a new case, or just somebody accuses them of having done something, before COVID-19, those holds, those people would go straight to, they put out a warrant for their arrest. The police would arrest them, take them straight to the jail, and they'd sit there until it got resolved. And so there's a couple of phases of that. One phase of getting it resolved is they do an investigation. That can take weeks. But if they decide that they're going to try and revoke you, then you have to go before a administrative law judge. So not one of our elected officials, but a private, well, not a private, it's a part of the Department of Administration, but an administrative law judge. And that can take months. So 90 days was one figure that we calculated how long people were in here, the average time before they went to a revocation hearing. So this was very rapid, this drop in the DOC holds, and it was a big change in their policy. And I'll come back to that when we say what we can do. And then finally, here are people that are pre-trial. So this is people that come in, they went through the arraignment hearing, and they either couldn't get bail, or the bail was so high they couldn't pay it. And so therefore they stayed in jail. They scheduled a trial, and they're waiting for the trial. Well, what happened in COVID? They stopped doing trials. So over the last year, as we come out to last Monday or whenever I did this, 22nd, I guess, you see the number of people in that pretrial status creeping up. And this is kind of warped what the defense lawyers can do, because there's a huge amount of pressure that the DAs can put on somebody that's been charged with something. If somebody says, well, I really didn't do it, I want my time in court, and I'm going to prove that I really didn't do it, that's the biggest counter that to what the DAs are offering in terms of a plea bargain. But if there's no court dates, or people have no idea when there's going to be a court date, then there's a tremendous pressure to say, okay, I'll take the plea bargain and let me out. And so that's one of the ways that COVID has kind of warped the criminal justice system in here in Dane County. So what does this tell us about what we can do? Well, a lot of this stuff, like the thing I told you about the warrants, how people could just be scheduled for a court date rather than being arrested and incarcerated for a warrant, that could go on. And the police say they're willing to do that. And the courts have more or less said that they're willing to do that. This change here, the DOC holds, that's a DOC policy. And in January, the DOC announced a set of new policies for supervision. And one of those policies is they're going to continue with what they call non-custodial revocation. And so that means they're not going to put people in jail. You know, it's always a caveat. If you're not a danger to yourself or to the community, then you can be eligible for this, and then you can be out. Now, right now, a friend of Moses is languishing in jail on an accusation, really, rather than that anything has been done. And they're investigating it, but right now he's sitting in jail. So the policy sounded real good when the Department of Corrections announced it. We'd like to see that in practice. But so far, you can see that at least as far as the Dane County Jail is concerned, here is out in December 2020, there's even a little drop. So the number of people that are getting put into the jail on holds is in fact dropping. And so maybe I shouldn't be too snarky about the Department of Corrections, but we do have a case that we're concerned about that is, in fact, seems to me would fit under this category and is not being treated that way. And then the other thing, I'll turn on another line. I'm going to get rid of the pre-arraignment line here, and I'll turn on a sentence line here. There we go. So this is the number of people who are sentenced and in jail. So if you go and go before the judge and you get a charge that a sentence that's less than a year, you'll spend it in the Dane County Jail rather than going into the prison system. So And so you can see that the number of people of sentenced that were in the jail went way down. Now, that kind of makes sense. If you're not having any court cases, then the number of people that were sentenced, you're not going to get new people sentenced there. Now, that's not completely true because there are people that they are having hearings. And so if you accept a plea bargain, then you can do that. But there's also been a lot of sentences that have been given and then stayed. So they say, well, you have to serve 90 days sometime, but you don't have to serve it until after the COVID is over. So those people are out sitting there. We've been told by the judges at the last Criminal Justice Council meeting, they said that each of the judges has about 1,000 cases sitting in their backlog. And so they're supposed to start hearing cases in person in June 1st. We'll see what happens, but you would expect this line to go down because people will get it. But it may be that the number of people down here in the sentence category will go up as you go through that. I think of the COVID crisis or the pandemic as having shown the criminal justice system that they can do better than they were doing. So, the total population in the jail went from something like, if you added all these lines together, you'd be up in the 700s, a little bit less than 800. And then it went down and it's in the 500s, the population of the jail. And it hasn't gone up a whole lot. You can see that, like there's a little bit of a rebound here, but then there's, a trough. Usually there's more people incarcerated in the summer than in the winter, but that's just a little fact.
Linda, I was wondering if you could chime in here with the chat just for people who are not tuning in on Zoom. Your anecdote is an important one, I think.
Yeah, I mean, we on the PO holds, that is the challenging. Even though I was mentioning in the chat that over the long Christmas holiday, we had, including one of our staff members who is on electronic monitoring, picked up on PO holds because their equipment was not charging properly, and so we had 4 people picked up on Christmas Eve and left in jail until the December 26th, 27th, and one of them even longer while the PO hold was investigated. But in all of those cases, the individual was at home when the police came to pick them up and could see that they were attempting to charge their equipment. So it's just incredibly frustrating. And for us as an employer, we get that. And when we have a staff person who ends up in a PO hold, we know our staff and we know that they're talking to people in jail, so we consider it part of their work hours because they're doing in-reach. But most employers aren't going to look at that way, and so it really does put people's jobs. And then as that ripples out, then their housing, if they've been fortunate enough to put housing in place, it ripples out and impacts that potentially as well. So yeah, it's just incredibly frustrating in terms of those PO holds.
Right. And I realize this is a whole different topic, but I just put a plug in. MOSES, well, Wisdom really has done a couple of studies on supervision. One, a health impact study showing that the stress of being on a supervision just shows up in many ways in people's lives, not only in the people who are on supervision, but also the families. And that there's people think, like, well, if you're incarcerated, well, that's a hard thing. But if you're on supervision, that's a very stressful thing too, because at any time, as Linda said, somebody can come knock on your door and take you away to jail. that's also one of the things that DOC said that they were going to fix in about supervision. And I'm waiting eagerly to hear people say that that's really stopped happening, that people have stopped being taken out of their houses in the middle of the night to, it's kind of Gestapo tactics, what's your, if you have the image of what's the worst thing that could have happened if you were, I don't know, a Jew in Germany, well, somebody would come along in the middle of the night and take your people in your family. Well, that happens all the time to us here in Dane County. It's just the people who are on supervision. So anyway, that's off topic. We're talking about COVID, but I do think that COVID has shown us ways in which at least the Dane County part of the criminal justice system can be improved. And if we can maintain those things, then we'll have a smaller jail and a more humane criminal justice system.
So where do we go now? How do we keep reminding them that it is possible to do things differently and keep that conversation going?
Well, one thing that Moses' strategy, particularly in Dane County, where we have legislators that are at least interested in our topics, is just showing up. And so one of our strategies has been both in person before and now virtually going to the CJC meetings and testifying about things that we think are important. We just did a series on of 2 forums on sentencing, and basically the idea that judges are not constrained in Wisconsin. They're not constrained by mandatory minimums. So if they decide that something like shorter, that the data-driven recommendation that supervision sentences not be longer than 2 years, or well, it's a little, there's some differences in the recommendations, but 2-3 years, they can start doing that, but they're not yet. So we're trying to pressure them to do that. We go before them to talk about it, and then of course forums and op-eds and other things like that. But we're trying to, like with the sentencing, judges are the ones that control that process. In Dane County, it's mostly plea bargains, so it's really the prosecutors and the defense attorneys that come together and make a decision which the judges more or less rubber stamp. So so prosecutors are less, there's really nobody that's over the prosecutors except for the elected DA.
I'm muted. Sharon, did you want to chime in there? Or?
Yes, if I could, I think that one of the most effective ways to address this issue is to humanize the very individuals that this issue most affects. And that is, for me personally, and I can't speak for anyone else, I'm going to be as involved as I possibly can be with as many wonderful things as I can possibly access. Tomorrow I'll be heading down to Waukesha to help build a park and for a program down there. I speak tonight, every time John comes up with, not comes up, but every time John has an event, I told him just pencil my name in. And the one thing that I think that we all need to do is to humanize us, because, I'm a college graduate. I'm a father. I was a father. My daughter's no longer with me. I have a lady friend who enjoys my company. I'm not the most unintelligent person in the world. I'm not going to win the worst man in the world's contest. I can sit down, I can communicate with you, I can listen to you, and most importantly, I can speak to you and tell you what my wants, what my fears, what my desires are. I am a human, but a lot of people don't see me as a human because they have been trained to believe that I am not a human. And I think that if we just take the time to introduce individuals like me to individuals like you, that we can go ahead and begin to make a change.
Well said.
Yes.
Definitely.
Yeah.
So we have about, it's 7:19 on my clock, and we have about 10 minutes for questions. You can put them in the chat, or feel free to unmute and ask it, live with your voice. I want to say just thank you so much for all of our speakers who showed up today and to talk about this. It's it's been very informative, and the work continues, right? Any questions?
While we're waiting, I just want to also mention that I think something people could advocate for over and over is not using jails and prisons as mental health treatment facilities. That is not the right place to treat people who have mental health issues, or substance abuse issues, which frankly is basically what they are. And so just advocate for that. There are many opportunities to do so. And if you hear people speaking against that, push back. So.
And I'll just put a plug in that we are working on a future Just Conversation session about that very topic. So that'll be coming up later this year.
Yeah, I appreciate that, Anne. I mean, one of the things we've been working on, and it's peripherally, I guess, related, which is the issue of a new location for a men's shelter and what that would look like. But I mean, one of the things, and we had talked a little bit yesterday, I mean, talking with colleagues who work in mental health, one of the things we've seen really clearly in the pandemic, because the city and the county did a good job of coordinating resources through the CARES Act and getting people who are medically vulnerable, including people with significant and persistent mental illness, into hotels rather than the shelters to alleviate the risk of spread, is that in talking with mental health professionals, the whole idea that we've been able to put people in a safe space 24/7, their own room, 3 meals a day, with someone who is on site in terms of a mental health professional, a peer specialist checking in on them. Some of these individuals have not been, are functioning and doing better than they have in a decade. And so the idea that our jails and prisons have become mental health facilities de facto, when we can look at what the city and county have done with that COVID money and say, no, this housing first and supported housing and community-based mental health, this works. We've just not had the political will or courage to invest in it at the same level we're willing to invest in incarceration.
Right, and that's going to be coming up, I think, because the county and the city have at least started on 2 important initiatives. One being an alternative first responders for mental health issues, and it has different names, but most people know it as sort of a cahoots style program. And the idea is that instead of when somebody's having a mental health crisis, instead of sending a police person who's going to demand a certain kind of following instructions and so on and so forth, things that mental health folks often are not able to do, they'll send out healthcare and crisis managers. And so that's the first step. And then the idea is that they would take them to a triage restoration center, which is in the planning stages right here in Dane County. And so that's like a 24-hour project. But the idea is to try and figure out what's going on with people, trying to figure out a better place, what kind of supports they have, what can happen. And so that's a short term, but an important thing. And both of these projects are in the planning, but they're both definitely happening. I mean, the Kahoot style program is pilot for it is actually underway. And then But the question is, so what happens 24 hours later after that person has to leave the triage center? Well, that's where the Housing First comes in. And that's why I was saying that, Dane County has done two really good things, or is planning to do two really good things. And we hope they turn out to be really good things, but I expect they will. But Housing First will become like the next step in that process. And so what Linda was bringing up, rightly so, and I think that's such a compelling story about the pandemic. Pandemic money allowed the county to do something that they might have wanted to do, and it turned out to be very effective. And so we can say, okay, can we continue doing that? Well, it's going to take money, and that's where politics is going to come in, which is where organizers come in.
All right, any last comments or words of wisdom? All right, we will end there. Thank you so much for everyone who spoke and everyone who attended. This has been incredibly informative, and yeah, it looks like we have a lot of work to do still, and it's great that everyone wants to be informed and do the work. I'll just put in a plug that these are monthly conversations. We have some very interesting Just Conversations coming up. In May, our Just Bakery Program Coordinator, Carmela Glenn, is going to facilitate a conversation with a bunch of different restaurant owners about doing social good through restaurant businesses. And then in May, we tackle housing. So that should be a very informative conversation. We have Heidi Wegletner coming in, and Tenant Resource Center, and some of our staff members from the Rapid Rehousing program at JustDane. So look for those coming up. And
I'm going to put in one last plug because I realize people on Facebook can't see the chat. May 4th, the Madison Common Council will be voting on the 2002 Zaire Road site for a new men's shelter. This will be a purpose-built shelter, different than anything we've had over the last 36 years, and could provide a wealth of services on site in the shelter so that we can be where people are versus expecting people who are already struggling and stressed to come to us. And this is a whole different model. So are hoping people will weigh in with their alders and express their support for this new shelter site. It meets all of the criteria the city staff were looking for. It is the 16th site they have looked at. You might remember in October, the last one was bought out from under the city by the owner of the Princeton Club because he didn't want a men's shelter by his site. And, but we really need this. And the shelter this purpose-built shelter could do a lot to assist men in our community who are experiencing homelessness right now.
thank you. Everyone have a wonderful evening.
Thank you to everyone.
Thank you. Bye.